Gastroenterology last-minute flashcards. A child with history of asthma and severe eczema is having progressive dysphagia and recurrent food impaction. Esophageal biopsy shows increased intraepithelial eosinophils. Eosinophilic esophagitis, EE, commonly associated with allergies, for example, asthma, severe eczema. The key word here, very important to remember, recurrent food impaction. Eosinophilia in the blood. But to confirm the diagnosis, the esophageal biopsy will show positive eosinophils. Diagnosis of eosinophilic esophagitis, endoscopy is the mainstay for diagnosis and biopsy. You may see ring-like structures and small whitish papules representing eosinophilic abscesses. On CBC, you may see peripheral eosinophilia. Treatment of eosinophilic esophagitis or EEE, elimination diet with proven allergies or provide elemental diet. 75% respond to milk elimination. Almost 100% respond to amino acid formula, especially in infants and young children. For older children and adolescents, the mainstay of treatment is inhaled and systemic steroids and montelukast. If left untreated, this can cause esophageal strictures. How to differentiate EEE from pill-induced esophagitis? In pill-induced esophagitis or dry pill or drinking pills without water, this will cause deep singular ulceration at points of carina. Child accidentally swallowed caustic liquid 6 hours ago. Presents with dysphagia, oral pain, chest pain, nausea, and vomiting. Best management is endoscopy in 12 to 24 hours after ingestion. Avoid neutralization of caustic liquids. For example, giving milk may cause more injuries. Swallowed a coin, no symptoms, and radiograph showed the coin is still in the esophagus. In this case, coin in the esophagus, observe for 12 to 24 hours. Removal is recommended if it doesn't pass to the stomach or if the patient became symptomatic. For example, if excessive drooling and chest pain, the next step, immediate removal. If it's bottom battery, immediate removal, no wait. Swallowed a coin, no symptoms, and radiograph showed the coin in the stomach. This is the most common scenario. Coin in the stomach with no symptoms, the recommendation is to check the stool for passage of the coin for 4 weeks, with weekly radiographs if indicated. If the coin doesn't pass through the stomach by 4 weeks, or if the patient is symptomatic, removal by endoscopy should be considered. If bottom battery and passed to the stomach with symptoms, immediate removal. If no symptoms, observation can be considered.
Having trouble or trying to pass the pediatric board exam? We have the definitive solution for you, presenting the Last Minute Review series, a powerful tool for achieving success in pediatric board exams, crafted by Dr. Osama Naga, a board-certified pediatrician by American Board of Pediatrics and the editor of the Pediatric Board Study Guide, a last-minute review. Dr. Naga breaks down the most critical subjects in this series. The Pediatric Last Minute Review webpage offers a thorough and rigorous set of pediatric board review sessions that are in line with the study guide. The lectures will cover the most important topics for each condition that a pediatrician must know for pediatric board exams, as well as real-life clinical encounters. The inclusion of a clinical case scenario, accompanied by multiple-choice questions, followed by the most probable answer and a comprehensive description of the issue, will ensure test readiness for each student. You will be able to download the lecture's PDF files to make your studies easier, to take notes and be accessible on the go and offline. Based on the membership plan you choose, you will have unlimited access to the lectures for either 1 month, 3 months, 6 months, or 1 year. By viewing these videos, you will increase your chances of passing the board exam and gain substantial advantages from the acquired knowledge. Additionally, by studying the material and completing the AAP prep questions from the previous 3 years, you will greatly increase your likelihood of passing the board and will acquire a wealth of knowledge. Click on the link provided below to visit lastminutepediatric.com and subscribe immediately. Be sure to take advantage of our free video samples on our YouTube channel, Pediatric Board Last Minute Review. Good luck with your exams.